I'm Dr. Clifford S. Mitchell, and I'm the Assistant Director for Environmental Health and Food Protection at the Maryland Department of Health and Mental Hygiene. So, shortly after the Cold War, after World War II actually, and the use of the first atomic weapons, there was concern during the time when we were doing testing about the ability of the United States to monitor radiation and radioactive fallout across the entire country. This led to the development by the United States government of a system of radiation monitors that gradually evolved over the next 50 to 60 years to the current program, which is run by the Environmental Protection Agency called RADNet. And that network of radiation detectors consists of fixed and mobile monitors. Those fixed and mobile monitors are used to collect samples of rainwater, of air, of particulates, and in some cases biological samples such as milk, and tested at U.S. facilities in order to understand patterns of both naturally occurring and man-made radioactive fallout and radiation. So across the country, not only does the federal government monitor radioactivity and radiation, but many states are involved in these efforts as well. The principal efforts here in Maryland and across the country are typically associated with nuclear facilities, the so-called fixed nuclear facilities, otherwise known as nuclear power plants. And what those consist of are a series of monitors, very much like the monitors used by the federal government in the RADNet program, and they are used to monitor radiation around the fixed nuclear facilities. The reason for doing this is twofold. First, it gives us some idea of what naturally occurring and other kinds of man-made radiation may be in the environment generally and around those fixed nuclear facilities. And then most importantly, it provides a detection system in the event of any kind of accidental release or failure of the nuclear facility. And it allows the states to have both baseline data, which they can then use and look at over time, and it also gives them, in addition to the radiation detection systems in place at the facilities themselves, it gives the states another check on radioactivity in the area. So here in Maryland, what we have is a system that is run by our Department of Natural Resources and our Department of the Environment, and they work very closely with the laboratories here at the Department of Health and Mental Hygiene. Specimens are collected on a regular basis, both for air, for water, and then periodically for milk as well, and those are tested in the Department of Health and Mental Hygiene laboratories. Those results are analyzed on a regular basis to ensure that there's no inadvertent release of radiation, and also to provide long-term information on the status both of the nuclear power facility and of the surrounding area. So the shortest lived of the isotopes are generally, for example, radioactive iodine has a half-life of 8 days, which means that every 8 days, half of the original radioactive material is gone. In the case of other isotopes, however, for example, plutonium is very, very long-lived. It can last tens of thousands of years. And then there are isotopes such as cesium that are in the middle of that range. So the way we would look at this would be to look farthest upstream, because remember, we want the radiation to be detected as far away from people as possible. And so we look upstream in rainwater, and then we would look in drinking water or in leafy vegetables, and then we would look in, for example, milk associated with the bioconcentration or concentrating effect of those chemicals. And so in order to be protective, we look all along the way. We look at the rainwater, we look at drinking water, we look at vegetables, and we look at milk. And generally speaking, if there is material present, you'd expect to find it first in the rainwater, then in the vegetables, and it would show up last, actually, for example, in the animals, in the milk. But you would also expect there to be a lag so that it might also disappear last in the animals as well, which is the reason we are continuing to monitor even well after levels have gone down in Japan. So if you look at the EPA RADNet data, what you're seeing essentially is no detection of any of those materials, the plutonium or any of the other radioactive bad actors in any samples, either in the United States or west of here, for example in Guam, where there are detectors as well. And you're not so. And in addition, the Food and Drug Administration has been looking for and continues to look for evidence of radioactivity in imported foodstuffs and does not find any evidence in imported foodstuffs as well.